Hello everyone, Homoeopathic welcomes you with one more drug Bacillinum in this video. Basically, Bacillinum is a tuberculinic nosode which is first named and described by Dr. Burnett, which is why it is also known as Bacillinum Burnett. Talk. As Bacillinum is a nosode, it is prepared from the sputum of tubercular patient or from maceration of tuberculous lung. Symptoms of Bacillinum are liable to both children as well as adults. The person looks emaciated and complains of poor appetite. It is hard for them to gain the weight. There is lot of sensation of coldness, sometimes associated with trembling of hands. Moving on to our next slide, mind. Bacillinum person has craze for movement. He doesn't want to settle in one place, which is why he wanders from one place to another. Because of this, he feels as if he is stranger in his own room. Other than this, his timid gets easily afraid of everything, particularly to dogs. He's irritable, he's snappish, he uses abuse words. He's taciturn, sulky, whines, complains, depressed, sad, melancholic, even to the level of insanity. Dr. Young says he has treated many idiotic patients with doses of Bacillinum. Then, headache. The headache is so violent, deep, terrible, as if a tight hoop of iron band is present around the head. Similar sensation is also seen in cactus. This type of headache is aggravated by slightest head movement and after school tasks in children. The face looks very angry and indolent, pimples on one cheek, which breaks out on time to time and persists for many weeks. They are very slow healing. To our next slide, teeth. The teeth are imperfectly developed. There might be presence of tartar and dental caries on teeth, where the person might also grind teeth in sleep. Aching of teeth, especially in lower incisors and the teeth which are very sensitive to air. Then, tongue. The tongue shows the appearance of strawberry. Moving to throat, there will be tickling sensation in fauces which compels the person to cough. Then, respiratory system, nose. The nose has small painful furuncles on nasal orifices. The discharge from nose is greenish, fetid pus and has oozina. Then, patient complains of oppression, catarrhal dyspnea, sharp pain in precordial region which arrests the breathing, and bronchitis with jerking and fatiguing cough, suitable for old people with chronic respiratory disorders. Cough. The cough shows many characteristics like slight, tedious, hawking cough, hard cough, shaking patient more during sleep but does not wake him up. Cough waking him at night with easy expectoration. Single cough on rising from bed in morning. Prickling in larynx with sudden cough. There is presence of sharp pain in left and inferior scapula which is aggravated by lying down and ameliorated by warmth. Expectoration. The expectoration is of mucopurulent with bubbling rays. To know whether the person is getting better after giving Bacillinum or no, one should observe the expectoration where it becomes less purulent and more aerated. Abdomen. The abdomen looks like drum, bloated, presence of meteorism, that is, easy accumulation of gas causing the patient uncomfortable with abdominal pains. There is presence of tapes mesenterica where the lymph nodes are palpable and indurated. The glands of both groins are enlarged and indurated. Moving to next slide, stool and anus, there is morning diarrhea, sometimes associated with nausea and sweat. It may alternate with obstinate constipation, where the flatus is very ill smelling and presence of stitch-like pain is felt in piles. Urine. The urine is pale, abundant with white sediment and with presence of nocturia, where the patient gets up many times at night to pass urine. Locomotor system. The person has general weakness on back and because of high sensation of coldness, the person feels that there is damp cloth on spine and there might be tubercular inflammation of knee and pain in left knee which is aggravated on whilst walking and ameliorated on continued motion. Skin. The skin of Bacillinum shows ringworm of scalp, alopecia areata, impetigo of head, pityriasis, eczema on eyelids, head, behind ears, and presence of button-like eruptions on left chest, juvenile acne, which are long persisting with copious sweat. Sleep. The person feels drowsy during day, sleepless at night. He talks in sleep and has more dreams with nocturnal hallucinations. Fever. In fever, there are flushes of heat and perspiration, sometimes associated with violent headache. Flushes of heat might increase after one dose of Bacillina. Some of the positive diagnoses by Julians for the drug Bacillinum are there will be craze for movement, the headache which is deep, aggravated by the slightest movement, eczema of the eyelids, impetigo, the chronic cough with abundant mucopurulent. Modalities aggravated by movement, cold air at night and in early morning, ameliorated by continued motion, heat and change of weather. Relationship. It is complementary to Calcarea fos and Calica and similar to Cox tuberculinum. While giving the dose of Bacillinum, it should not be given below 30th potency and should not be repeated frequently. Clinically, to find out the cases of Bacillinum, it is suitable in the cases where the respiratory and skin complaints are seen together, where there are enlarged lymph nodes. It suits well as an intercurrent remedy and where the expectoration is easy and there is congestion of the chest. These are the references and thank you.